So a stroke is when part of the brain doesn't get blood flow. That's an ischemic stroke. There's also hemorrhagic strokes where there's bleeding in the brain, subarachnoid hemorrhages, perhaps when an aneurysm bursts, or intracranial hemorrhages. F.A.S.T is what we do at St. Luke's, but F.A.S.T is also the acronym that we use to teach the public about stroke. And F stands for face, so you look at the person to see if they have a facial droop. A is for arm, and that means an arm weakness, so you can hold your arms out in front and see if they have a drift or if one arm can't come up. S is for speech, so if somebody has slurred speech or perhaps if they're having trouble talking and getting their words out. And T is for time, and we like to put a lot of emphasis on the T, meaning that if you see somebody with those stroke symptoms, you don't wait. Our treatments that we offer for ischemic stroke are all time-based. The IV clot buster, called TPA, has to be given within the first 4.5 hours of the symptoms onset. So you have to get to the hospital quickly and have some tests done to make sure you're a good candidate for that. When you go a step further and you talk about opening up the blood vessels in the brain by a thrombectomy with our neurointerventionalists, again, the sooner that you can get that blood vessel opened and restore blood flow to the brain, the better you do. And what that means for real life is that might be the difference between somebody having a paralysis versus somebody being able to return to full functional living and driving and working and living a full life.